Today we're going to talk about SPD in pregnancy, whether it's SPD, Symphysis Pubis disorder, pelvic girdle pain, Fanny daggers because that's what it feels like. Polite people call it lightning crotch. What is it? What's causing it? And how can you help yourself? So Symphysis Pubis disorder, SPD, is in the pelvis. So your symphysis pubis is this joint here in your pelvis. If you are looking at yourself, or for me, it's right down here, right at your crotch. And when we're pregnant, our bodies produce more relaxin than they normally would. And relaxin is a hormone that allows your body to adapt and grow, and those ligaments to stretch with your body as your baby grows, which is great. But a lot of women get too much relaxin. So if you think of that symphysis pubis joint, which sits right down here, if you turn, we get a wee twist in at that pelvis, yeah? If you get out the car, we can create that pain right in at your pubic bone right there. It feels sometimes like somebody stabbing. So what can you do to help yourself? A lot of ladies worry that this is going to make labour more difficult for them, but this is part of your body's process for labour, that it's allowing the body to grow. So the majority of the time, this will amend itself after pregnancy. I would always say if you've had bad pelvic pain, you should always get checked out by a women's health physio. There are lots of women's health physios we can recommend. But things to make your life easier. Normally when we put on socks, we stand on one leg, we lift the foot up and we put the socks on. When we put your pants on, you will balance on one leg. So when we're doing this, sit down. If you're still shaving your legs, you stand in the shower and you shave. Sit down. When you're getting in and out the car, you take one leg out, then you follow with the other leg. Swivel. Make sure that you keep them together. Things like this that are causing you a problem, especially desk-based pregnant people, you put one foot in the ground, you put hands on the desk and you twist and you open out the pelvis. That causes the sharp pain. So things like hoovering, if you've got a heavy hoover, you're putting one foot in front of the other and you're hoovering. Stop it, make somebody else do the hoovering. Something as simple as, I know a lot of us live these days in Lycra. Ironing, because it's that twisting motion. Get somebody else to do it or just start wearing stretch clothing. These are some of the small details that we cover in our pregnancy classes. It's not just your antenatal education, it's not just breathing, a bit of soft stretch. I actually have a lot of clients come to class that suffer really bad SPD, but all the movements are adapted for our adapting bodies. If you've got any pregnancy questions, fire them on the chat below and we'll see if we can do some more videos to help make your life a wee bit easier. Oh, swimming. A lot of people say swimming. Swimming is good, yes, because it takes the weight of baby out the pelvis, but if you're doing breaststroke, if your kick is off, you're going to exacerbate your pelvic girdle pain. So make sure, crawl only with the legs. If it's really bad at the end of the night, one of the best things I can recommend is if you get yourself onto all fours and take your head down onto the ground and your bottom up into the air. That then takes the weight of your baby up towards your chest and it takes the weight out of your pelvis. So spending 5 minutes at night, head down, bottom in the air, can help relieve that heavy weight in your pelvis. For more hints and tips, check out my socials and I hope this eases your pregnancy.